Michael Jordan, of course, had his famous flu game that may or may not have actually been from the flu, and now it looks like Anthony Davis might have had his own flu game. While dealing with an illness, Anthony Davis finished with 25 points and 10 rebounds last night in their game against the Nuggets, and even had to receive some IV fluids at halftime. Welcome back, everybody, to your #1 source for learning about everything related to sports injuries and sports medicine news. Of course, this doesn't sound like anything related to sports medicine, but as we saw last night with Anthony Davis, athletes are just as much at risk of getting things like colds and the flu as the rest of us, and we have to understand how to treat them and take care of them and how it might affect their play. And if you're anyone like me dealing with a cold right now, winter's here, it's prime flu season. This is stuff that's going to happen with all of us likely at some point or another. So I thought it'd be interesting in this video to take a look at some of the key things to think about or remember when it comes to colds and the flu, and we'll tie in as much related to Anthony Davis as we can. Make sure and go subscribe if you like this type of content and want to stay up to date with my future videos. Let's get started. I'm going to hit on 5 things related to colds and to the flu. First off, we'll talk about the difference between a common cold and the flu. We'll then talk about one of the biggest questions that comes up regarding treating the common cold, the idea of whether or not to use antibiotics. We'll talk about what causes the specific symptoms and why you feel the way that you do when you have the flu or the cold. We'll discuss how to treat it, and then finally wrap up by talking about what this could mean for AD over the coming days. First off, people are referring to this as kind of AD's flu game, implying that he had the flu. This might seem like a minor technicality, but there is a difference between someone who just has the common cold versus someone who has actual influenza. Both of these are caused by viruses, but your common cold is more often what we actually get during these winter months where you have the runny nose, you're stuffy, you've got a sore throat, some muscle aches, but overall aren't all that sick. Most of the time, the common cold is caused by a specific virus called the rhinovirus. It's spread through any sort of respiratory pathway, so sneezing, coughing on your hand, touching a doorknob, anything that's going to get that into the nose, into the mouth, into the lungs. The flu, on the other hand, is caused by the actual influenza virus. This is typically a more severe presentation with much worse symptoms, usually is a more serious condition that we've heard about in the past with things like the Spanish flu, bird flu, all these different types of influenza type conditions that are much more serious often than just the common cold. Either way though, both of these would be really hard for anybody to get through their day of work, let alone go and play an NBA game and perform like AD did. Next, if you can take away anything from this video, it's that antibiotics do not treat the common cold or the flu. Antibiotics are specifically targeting bacteria, and as I previously said, the flu and the common cold are caused by viruses. The problem if you give someone antibiotics when they don't actually have a bacterial infection is it causes your body to build up resistance to those antibiotics so that when you actually do need them, they don't work as well. Now, when it comes to the flu, there is an actual medicine called Tamiflu. This is an antiviral, meaning it targets the virus. If it's given early enough with the flu, it can reduce the duration of the symptoms. The question of if you have a viral infection or a bacterial infection can get a little bit more detailed and something you should talk to your doctor about. But if you have the common cold, if you've got the flu, antibiotics are not for you. Next up, when we have the cold or we have the flu, we feel crummy, right? We have a runny nose, we have a sore throat, we have fevers, we have body aches. All these things are happening in our body, all because of this virus. And you might not be surprised to learn there's specific reasons and causes for why we feel each of these symptoms. First off, my least favorite part of having a cold, the runny nose. Whenever you have an immune response in your body, certain cells release a product called histamine. Histamine acts on these cells, particularly in like your nasal passages and your airway, and cause them to produce additional mucus or snot, which gives you this runny nose. That's why taking medicines like Benadryl, which is an antihistamine, sort of dry up your nose and try to limit the production of that mucus. Next up, the fever. So your fever is actually your body's natural response to having any sort of infection. It's kind of like a built-in protective mechanism. The actual specific chemical that triggers the fever is something called a cytokine. It's this molecule that does different signaling throughout the body, and in particular, it's IL-1, goes up and acts in the brain and the hypothalamus, which tells your body to increase its internal temperature to try to essentially burn off or kill those viral cells. Finally, those dreaded muscle aches, just feeling sore and just beat throughout your whole body. This is more a factor of just that general immune response. When you have a viral or bacterial infection, your body's immune system sends in all these white blood cells to try to fight that infection, and those white blood cells release all these different chemicals, like the IL-1 I previously mentioned, and a bunch of other ones that give your body this painful sort of feeling, particularly in your muscles and in your joints. Next up, what do we do to treat this? Now, if you're an NBA player like Anthony Davis, you can go back to the locker room in halftime and get IV fluids to make you feel better. But for the average person, we don't really have that luxury. When you have a viral infection like the cold or the flu, it's all about treating the symptoms. We heard Anthony Davis talk about getting fluids at halftime, and so staying hydrated is one of the keys to helping you feel better. When you have this infection, your body's metabolism gets ramped up as your cells are trying to fight off this infection, and that causes you to become more susceptible to being dehydrated. The other thing we can do is we take different medicines to try to target these different symptoms to help them go away. We saw AD specifically mention DAYQUIL as one that he was going to be taking. The acetaminophen is trying to reduce the fever, try to limit the pain from those muscle aches. The dextromethorphan is trying to suppress that cough so that you're not having this irritating cough throughout the day. And the phenylephrine is acting to try to decrease all that congestion that you might get and all that stuffiness up in your nose. The difference with NyQuil is there's basically an antihistamine added. It's called NyQuil because you take it at night, and that antihistamine has a side effect of making you sleepy, but otherwise it's the exact same thing as DAYQUIL. It's just got an antihistamine and it makes you sleepy, so they call it NyQuil. But again, none of these medicines in DAYQUIL, NyQuil, or any of the others are actually targeting the virus. All they're doing is targeting the symptoms that you get because of how your body attacks the virus. Let's finish up by talking about what this could mean for AD over the coming days. I suspect he probably just has a common cold. If he actually had influenza, I don't think he would have been able to play in tonight's game because typically it's much more severe. The common cold typically lasts around 7 to 10 days, and so this could be something that lingers with him for the rest of this week before he really starts to feel better. The big thing though for the Lakers to think about is the risk for the rest of his teammates. We saw last week the Patriots took 2 different planes for their game because they had so many people sick on the team, and the Lakers need to make sure that they sort of keep AD away from the rest of the team to limit the risk of him infecting other people. Certainly practicing all the good hand hygiene, washing your hands, making sure he's coughing into his sleeve or something like this. All those different strategies to try to prevent the rest of the team from getting sick just from hanging out on the plane, in the hotels, and in the locker room. That's it for the video though, everybody. I hope you guys survived this winter without getting the cold and without getting the flu. But if you do, don't worry, you're in the same boat as Anthony Davis, and hopefully this video gave you some interesting information about what's going on inside your body when this happens. Thanks as always for watching, and I'll see you in the next video. Bye.